Have you ever thought about your body as a battlefield? Well, it is. Every single second, it's in a state of constant warfare, defending itself against all sorts of threats. Not just from the outside world, but from the inside too. So let me start with a question for you. What in the world could possibly connect an ancient, tricky infection to, say, a common bone fracture that an elderly person might get from a simple fall? I know, they seem like they're from completely different universes, right? But as we're about to see, the links between them are, well, they're pretty fascinating and sometimes pretty dangerous. So let's stick with this idea of the body as a battlefield. In any fight, you have to know what you're up against. So today, we're going to scout out three main fronts. First, we'll look at the invaders that come from the outside. Then we'll turn inward and look at what happens when the body's own structures start to fail. And finally, we'll dive into a kind of civil war where the body's own defense force actually turns on itself. All right, let's start with the classic enemy, the one we all think of first, the external invader. And for our case study, we're going to look at a disease that has a really long and frankly notorious history, syphilis. So what exactly is this invader? Syphilis is caused by this little corkscrew-shaped bacterium, you can see it there, called Treponema pallidum. It's a chronic disease, meaning it sticks around and it's usually passed through sexual contact. And what's really concerning is that after years of decline, infection rates have actually been on the rise again. Now, here's what makes syphilis so insidious. If you don't treat it, it attacks in stages. It starts out sneaky with a single painless sore in the primary stage. Then, weeks or months later, it goes system-wide in the secondary stage, causing rashes, fever, the works. After that, it can go quiet for years, into a silent latency period. But it's not gone. It can reemerge in the tertiary stage, and that's when it does devastating, slow-motion damage to the heart and the brain. It's a really patient and deceptive attacker. Okay, so that's the enemy from the outside. Now let's shift gears and look at our next threat. This isn't an invader breaching the walls. This is the fortress itself starting to crumble from within. It's a breakdown of the very structures that hold us all together. And this is what that kind of breakdown can look like on a large scale. I mean, look at these x-rays. You're seeing severe fractures that need major surgery, plates, screws, the whole deal. This isn't just a simple break. This is a catastrophic failure of the body's internal architecture, and it can completely change someone's life, their mobility, everything. So what's going on behind the scenes to make bones so vulnerable? Well, a lot of the time, the culprit is osteoporosis. The name literally means porous bone, and that's a perfect description. See, your body is constantly breaking down old bone and rebuilding new bone, but with osteoporosis, that system gets out of whack. The demolition crew, these cells called osteoclasts, starts working way faster than the construction crew. This imbalance is what makes the bones so fragile and so easy to fracture. And this slide right here gives us an incredible microscopic look at what porous bone really means. Just look at the difference. Healthy bone has this dense, interconnected, web-like structure. But the osteoporotic bone, it's just hollowed out. All those huge gaps and empty spaces, that's weakness. It creates the perfect setup for the kinds of devastating fractures we just saw in those x-rays. Now let's talk about our third threat, which is maybe the most confusing and tragic one of all. What happens when the body's own military, its own defense force, the immune system, gets confused? What if it stops being able to tell friend from foe and starts attacking its own tissues? You basically get a civil war raging inside your own body. And this brings us to a really important distinction that a lot of people get mixed up. On the left, you've got osteoarthritis. You can think of this as simple mechanical wear and tear. Over a lifetime of use, the cartilage in your joints just wears down. But on the right, you have rheumatoid arthritis. And this is a completely different beast. This is an autoimmune disease. Your own immune system mistakenly targets the linings of your joints, causing this chronic, painful inflammation all over your body. So one is a mechanical problem, the other is a tragic case of friendly fire. And the consequences of that friendly fire, they can be absolutely heartbreaking. This image shows the kind of severe joint deformity that can happen from the constant inflammation of rheumatoid arthritis. This isn't just about achy joints. This is about the body literally destroying itself, leading to a progressive loss of function and a whole lot of pain. Okay, so we've looked at threats from the outside and breakdowns from the inside. But what happens when these two problems collide? What happens when an external invader gets a golden opportunity to attack our weakened internal structures? Well, that collision can lead to something called osteomyelitis, which is a very serious infection of the bone itself. And look how perfectly this connects our themes. It can be exogenous, where an infection gets in from the outside, maybe through a deep cut or, you guessed it, an open fracture. Or it can be endogenous, where an infection that's already in the body, like a bacteria in the blood, just gets carried along until it finds a place to settle down and grow in the bone. It's truly the perfect storm of an outside invader exploiting an internal weakness.
So with all these battles going on constantly, how do we even begin to manage the front lines? Well, this is where our healthcare allies come in. The nurses, the doctors, the therapists. They have entire playbooks of strategies to assess the damage and to fight back. And let's bring this back to a real-world person. Think about this sentence. An 83-year-old female slipped and fell, experiencing a hip fracture. That simple statement tells a whole story, doesn't it? It combines those age-related internal weaknesses, like potential osteoporosis, with an external event, a simple fall, leading to a life-changing injury. This is the reality that doctors and nurses are dealing with every single day. So when a patient like that comes in, how do they figure out how bad the damage is? Well, healthcare pros often use a quick checklist called the 5 Ps. First, they ask about pain. Makes sense. Then they check for pallor. Is the skin pale or discolored? They check for pulses below the injury to make sure blood is still flowing. Then they ask about paresthesia. That's any weird numbness or tingling. And finally, paralysis. Can the patient still move everything? It's a super fast, super effective way to get a snapshot of the situation. And of course, the strategy has to match the threat. You can't fight every battle the same way. For an external invader like syphilis, the weapon of choice is a powerful antibiotic like penicillin. For a mechanical breakdown like osteoarthritis, the strategy is all about management, exercise, weight loss, controlling pain. For the civil war of rheumatoid arthritis, the goal is to calm down or suppress that overactive immune system with special medications. And for a deep, stubborn bone infection like osteomyelitis, you have to bring out the big guns, a long, aggressive course of IV antibiotics. See? Every battle needs a different weapon. So we've seen how our bodies are in this constant, relentless fight on so many different fronts. From microscopic bacteria to the slow decay of our own structures. The battle never really stops. And the main thing to remember is that this isn't something that just happens to us. We're part of it. Which really leaves us with one last big question to think about. Knowing that our bodies are fighting so hard for us day in and day out, how can we be better allies in their defense?